Welcome back to our third video about Medicare. In the previous two videos, we discussed about what original Medicare does not cover and started to explore how to fill in the gaps that Medicare does not cover. In this video, we will look into more specifics about more coverage and options available for those who are on Medicare. We will talk about Medicare Advantage Plans, or as it's often referred to, Part C, prescription plans, Part D, and Medicare Supplements. As we discussed earlier, you can either fill in the gaps by adding a Medicare supplement plan with Part D, or you can do so by adding a Medicare Advantage plan that already has Part D included. Medicare Advantage is a lot like original Medicare, but often with more benefits. Medicare Advantage plans typically cover things that original Medicare Parts A and B doesn't cover, like dental, hearing and vision care, and fitness memberships. These plans are often offered by private insurance companies. Many insurance companies also combine prescription drug coverage, or Medicare Part D, and medical coverage in their plans. Here are some important facts to keep in mind when applying for a Medicare Advantage plan. You must be enrolled in both Medicare Part A and Part B and live in planned service area. You must continue to pay Part B premium to Medicare. You can't be denied coverage based on current financial or health status, including pre-existing conditions. You may be required to use provider and pharmacy networks, and your coverage and costs vary by plan and many change each year. These plans may charge a monthly plan premium. You will have an annual limit on out-of-pocket costs for covered services, which will minimize your financial risk in case of an expensive medical procedure. There are HMO, PPO, and HMO point of service plans. Usually you will have a chance to apply for Medicare Advantage plan annually during the annual enrollment period, which is October 15 through December 7. There is also a Medicare Advantage open enrollment for those who already have a Medicare Advantage plan. This is happening every year from January 1st through March 31st. And it's available to Medicare Advantage plan members only. During this time, you can switch to a different Medicare Advantage plan, or you can return to original Medicare. Enroll in Part D plan if returning to original Medicare. Keep in mind that just one coverage change is allowed during this time. Now, let's take a look at Medicare prescription drug coverage, which are also offered by private insurance companies and helps lower the cost of prescription drugs. As I mentioned earlier, there are two ways to get coverage. You can add a standalone Part D plan to original Medicare, or you can choose a Medicare Advantage plan that includes prescription drug coverage. And again, these plans are offered by private insurance companies. Drugs are grouped into tiers based on cost. In general, the lower the tier, the lower the cost. Deductibles may be charged by tier. Amount paid for prescriptions depends on stage. Dollar limits can change each year. Not all plans have a deductible. Many people never reach the coverage gap, and cycle starts over on January 1st each year. Here are some important facts related to standalone Part D plans. You must be enrolled in Part A, Part B, or both. May be required to use pharmacy network. Coverage and costs vary by plan and may change each year, and there is a Part D premium penalty for late enrollment. I will address the penalty for late enrollment in a separate video, so please make sure to subscribe and follow us for more detailed videos on Medicare and health insurance. Moving on to Medicare Supplement Insurance, or as it's usually referred to as medi-cal. These are plans offered by private insurance companies in your state. And here are a few facts about these plans. It helps pay some costs not paid by Medicare. Supplement original Medicare, Part A and Part B. Cannot be used with a Medicare Advantage. 8 plans with benefits standardized by the federal government. Medicare supplement insurance may help pay Part A and Part B deductibles, co-pays, co-insurance, and provider excess charges, costs for extra 365 days of hospital care after lifetime reserve days used, cost of blood transfusion, usually for 3 pins, cost of foreign travel emergency up to the plan limit. These plans do not have coverage for prescription drugs, so you would have to get a standalone Part D plan. Also, these plans don't cover routine dental, vision, or hearing care, eyeglasses, contacts, or hearing aids, but some plans may offer additional programs that may help with these costs. Again, this does not cover extra days in a skilled nursing facility after Part A benefit. It does not cover custodial care, help with bathing, eating, dressing, and does not cover long-term care. Here are a few more facts about Medicare supplement insurance. You must be enrolled in both Medicare Part A and Part B and live in the state where a plan is offered. There is no medical underwriting up to 6 months after enrolling in Part B at age 65 or older, and this is, by the way, the best time to enroll in a Medicare supplement insurance plan. You will have nationwide coverage and no need to check if your provider is in network. All providers who take Medicare assignment will be in network with a Medicare supplement insurance plan. This plan is guaranteed renewable as long as you pay your premium. And plan premiums may vary, even for some coverage. So shop and compare multiple options before you buy. Plans with more coverage generally have higher premiums. Keep in mind that Plan F is no longer available to those who turn 65 years old or older after year 2020, but as an alternative, it's worth looking at Part G for those who turn 65 years after year 2020. You must continue paying your Part B premium to Medicare in order to keep this plan. Make sure you don't confuse the Medicare supplement plans A, B, C, D, and so with the Medicare parts. You can refer to our first video with details on the Medicare parts to refresh your knowledge. As you noticed, most of the plans that we discussed so far in this video require you to have either Part A or Part B or both in order to qualify for additional coverage. It is very important that you enroll in Part A and B when you are first eligible, usually when you turn 65 years old. Or in case you missed that or disenrolled for any reason, you can enroll in Medicare Plan A, Part A or B during the general enrollment period, which is every year from January 1st through March 31st. Late enrollment premium penalties may apply if you delay enrollment in these plans. However, if you have been working past age 65 and had health insurance coverage provided by your employer, you won't have to pay a penalty. Again, assuming you had credible health coverage through your employer. And you will have a special enrollment period to enroll in Part A and Part B, which lasts for up to 8 months. You will also have 2 months to enroll in additional health coverage, either Part C or Part D. Make sure to enroll on time to avoid an additional penalty that could be applied if you don't have prescription coverage or Part D. I will have a separate video on the penalties, but here's an overview of penalties for your reference. It makes sense to enroll in Medicare when you first become eligible. For example, when you are approaching your 65th birthday, in some cases, delaying enrollment can subject you to a penalty. Most people who have worked at least 10 years or have 40 quarters and paid Medicare taxes are eligible for zero premium Medicare Part A. If you're not eligible for premium-free Medicare Part A, you will need to sign up for it when you first become eligible to do so. If you don't enroll when you're first eligible for Medicare, you can be subject to a late enrollment penalty, which is added to the Medicare Part A premium. Delaying enrollment in Medicare Part B is also subject to a penalty. Now remember, we discussed earlier that there is a premium for Part B which changes every year and you pay that amount. In year 2020, the Medicare Part B premium could raise as much as 6%, and it could raise for next year as much as 6%, right? And now it's $144.60. Some high-income individuals pay even more for Part B premium. Now, this is not a penalty. The penalty kicks in when you are delaying enrollment in your Part B, and it could be 10% per year. You may have to pay a late enrollment penalty for as long as you have Medicare Part B. The penalty amount could go up 10% for every 12 months period when you were eligible for Part B but didn't enroll. For example, if you waited 4 years to sign up for Part B, your penalty could be 40% of the premium. In this example, you might pay your Part B monthly premium plus 40% for as long as you have Part B. It's very important that you do your homework and carefully study the transition to Medicare in order to avoid all these penalties and headaches. If you don't enroll in a prescription drug plan or don't have other credible coverage, you will be subject to a penalty. The late enrollment penalty is calculated by multiplying 1% of the national base beneficiary premium, which is $32.74 in year 2020, by the number of months you were eligible but did not apply for a Medicare prescription drug plan. This amount is rounded to the nearest 10 cents and added to your monthly prescription drug plan premium. I will have separate video on the penalties and enrollment period, so please make sure to subscribe to my YouTube channel and stay up to date and educated on upcoming changes in healthcare. I really appreciate your support by watching my videos. If you have a general question, please address it in the comments below or feel free to reach out directly if you have a specific question or need help enrolling in a health insurance plan. I am a California licensed insurance agent and will be glad to guide you and help select a health plan that would work for you and your family. Thank you for watching.